Hi, welcome to another knee moment from Knee Fit in 5 and MSM Products. My name is Dr. Matt Lawless.
And I'm Scott Johnson with Physical Therapy. Dr. Lawless, we had somebody write in the other day, her name was Kim, and she said that she was very active before her knee replacement and she wants to be able to go back to playing golf. So she had a couple of questions. Number one, is that okay? Is it okay to go back to playing golf after a knee replacement? And number two, when can she go back to doing those activities again? And so I just thought it would be great because it is a common question of what activities are safe and that you would encourage after a knee replacement. And are there any activities that you would discourage people from doing after a knee replacement?
Yes, a great question, Kim. Thanks for writing in. The question as to golf and the safety of golf after a knee replacement. Yes, golf is very safe after a knee replacement. And, I think activity is very important. And I would highly encourage people to get out. And if they enjoy golfing, that's what I tell patients a lot of times before surgery. They say, my knee hurts too much. I can't golf. I can't do the things I want to. And that's one of the benefits of doing the knee replacement is giving them their life back so they can get back. They can golf. They can do those things. And people ask me to kind of segue on that, what can I do with a knee replacement? And with a knee replacement, I tell people they should be very active. Get out, walk, use your knee replacement. Go for hikes, ride your bike, doubles tennis. Almost anything you can think of, I think, is very safe with a knee replacement. Now, the only caveat is that there is a belief that maybe doing higher impact stuff repetitively, like repetitive jogging or sprinting, might wear out your knee a little quicker. So I do discourage my patients from jogging on a regular basis, from sprinting on a regular basis. Now, can you jog if the car is going to hit you? You need to get across the street? Certainly. Can you do a little run through the yard with your grandson or granddaughter? Absolutely. Those things are very safe. It's just more of the chronic nature of it that might wear out your knee a little quicker. But outside of that, ride your bike, get on a hike, do whatever you want to do otherwise.
Now, I usually will tell my patients if you go back to doing those activities again and you start to swell up and lose the range of motion that you worked so hard for, you need to probably back off and get your swelling under control, get your range of motion back, and slowly start getting back into those activities again. So kind of let your knee be your guide of when you're ready to get back to doing that.
Great advice. Yeah, that's exactly right. That's good advice.
So Kim, I hope this is a good answer for you, and we hope that you're back out there on the golf course quickly and shooting a wonderful round of golf.